The information in this video is provided for informational and educational purposes only. Hey everybody, welcome to another edition of the Morale Monologue. My name is Michael Morale. Okay guys, in today's video, I did something that I've been wanting to do for a long time. I took my tripod with me to physical therapy a couple of weeks ago, and last week while doing PT, we connected my cell phone camera to the tripod and recorded an hour-long video of the PT session that I went through with my physical therapist, Emily, along with their massage therapist, whose name is Javi. This week, they transferred me out of my wheelchair to the PT table, and what I did was I took this hour-long video and I sped it up about 400% and dubbed my voice over the video, trying to explain what Emily and Javi were doing with me. And I did this because I want you to see what I go through in physical therapy in hopes that it might help you. Remember, before starting any physical therapy routine or any exercise routine, make sure that you check with your doctors to make sure that it's safe for you. So the video that you're going to watch is not an hour long, trust me, but it is just a little bit under 9 minutes and 30 seconds. And again, my video today will probably be a little bit longer than most, but it's important information that I think will help you. So take a look at the video, and if you have any questions or comments, make sure that you leave those down in the description of the video, and I'll make sure that I answer each and every one. Thank you. Okay, so in the video, you're seeing my physical therapist, Emily, along with the massage therapist, whose name is Javi. They're going to transfer me to the PT table. So after Emily puts the gait belt around my chest, she'll lean me forward and Javi will place the slide board under my buttocks. Once he gets the slide board under my buttocks, they'll then transfer me in one motion to the PT table. Now, Emily could probably transfer me by herself, but you have to remember safety is also for the patient and the physical therapist. So she always gets Javi to help her with this. So now what she's going to do is she's going to place a wedge block under my foot, and she's working on the dorsiflexion on my feet. She's pushing down on my knee, which is forcing my foot in an upward motion, like toes up toward your knee. And then Javi is working on my other foot, getting the swelling away from the foot using lymphatic massage. Now, I did this video mistakenly in mirror format, so it looks like Javi's working on my left foot, but in reality, he's working on my right foot, and Emily is working on my left leg. So we'll do this for about 5, maybe 7 minutes each side, and Emily stretches my leg out to get my leg as straight as possible. When I started physical therapy years ago, my legs were only able to extend to about a negative 48-degree angle. Now it's in the negative 20s, which is much better. Okay, so now you're seeing them switch sides, and Emily will work on my right foot. She again places the wedge block under my ankle or under my foot, and she's pressing down, not really all that hard, but hard enough to get the foot to flex in an upward position. And she'll sometimes put her hands on my knee, which is also in a downward motion, which can help eliminate some of the pressure that I'm feeling. In this part, she places my foot on her shoulder, and she's working in different positions to stretch the calf muscle, and also it tends to stretch the hamstring muscle as well. So again, she'll press down with her hand, not really all that hard, but it really feels good now. When I first started, I didn't like my feet being touched, but it was because I was so swollen and really had no range of motion whatsoever. But over the course of 4 or 5 years, my foot has definitely gotten better. Javi's also working on the top of the muscle in my leg to get some of the tension out. And in just a little while, you'll see where I told Emily that my calf muscle in my right leg was really sore one night while I was trying to sleep. So in just a little bit, you'll see her actually start massaging that calf muscle. And I will say this, I'm glad that the video camera wasn't looking at my face or pointing toward my face, because this was a little bit uncomfortable for me. So right now, Javi is moving the physical therapy table up to where he can start working on stretching my neck and working on the muscles in my neck and my shoulders. This has helped tremendously, because if you sit in your wheelchair as long as I do, and if you have SMA, you probably do, you tend to get a lot of tension in your neck and your shoulders, especially if you're sitting in front of a computer screen as many hours as I do. So this has really helped relieve some of the tension. And I don't know if you noticed or not, but when they were transferring me to the PT table, you'll see that my neck and I think my shirt was covering it, but my shoulders were also a little bit red. And that was because Emily had performed some cupping procedures, which helps pull some of the blood up into the muscles in the shoulders and the neck. And cupping has really, really helped me. Make sure that you talk to your physical therapist and your doctors about what you're seeing here, to see if maybe your physical therapist can do some of the same exercises that Emily and Javi do with me. Okay, so now she's working on that calf muscle. And again, I'm really glad that the camera wasn't pointing toward my face, because I was making some very unusual facial expressions. It's not really comfortable when she does this. It doesn't necessarily hurt. It's just uncomfortable because she's trying to get the knot that she found in my calf muscle out. And sometimes she has to press a little bit harder than normal. So now they're taking me off the wedge pillow, and we're going to start working on my hip flexors. So Javi will move me, or Javi and Emily will move me toward the edge of the table where my leg hangs off, and this is my left leg. So Emily will push down just enough to get a little bit of tension out on my hip and try to get my leg straighter, or more kind of under me. Most people that are able-bodied can actually point their leg behind them. And so that's what we're working on now. Again, this exercise is not really all that uncomfortable. It actually feels good because it relieves a lot of the tension in the muscles in my legs. But we've tried different positions, we've tried different exercises, and this one works out for the best. So now they'll move me back over to the other side of the table, and Emily will start working on my right leg, doing the hip extension. Again, she's using her own body weight to help her get my hip in a good position. I wish Emily could record some of this with her voice, because she could probably tell you all the muscles that she's working. She's really knowledgeable, along with Javi. Javi's been a great help because he's not only helped the tension in my neck and the swelling in my foot, but he's also really fun to work with, along with Emily. And physical therapy, and I think I've told everyone this, physical therapy is as much mental as it is physical for me. I get out of the house and I'm around some really good people, and I really enjoy physical therapy. So I know you're probably getting tired of seeing and hearing me talk about physical therapy, but I'm a huge advocate for it, and I always will be. So now Emily's going to roll me over on my side, and she's placing her hand, the palm of her hand, and I guess the back of her hand on my tailbone. I've been having a lot of trouble sitting in my wheelchair for long periods of time, and we found out it was because my tailbone was pointing behind me. So what Emily's doing is she's adjusting the tailbone, and she's able to move it forward and backwards and from side to side. Now, just recently, we started doing another procedure where she'll take a gloved finger, she'll actually put a glove on, and she'll insert her index finger through my rectum so that she can actually get to the tailbone from the inside. And she can perform what they call a sweeping motion, which relieves a lot of the tension from the tailbone, and it's really helped. We did this procedure about 5 weeks ago, maybe 6 weeks ago, and I've been sitting extremely comfortably without any numbness in my leg or my calf or my foot. So maybe we found out the reason why I was having so many problems. So when I'm on the PT table, she'll adjust my tailbone without having to do an internal procedure. But we have scheduled my second internal procedure for a couple of weeks from now. Okay, so I hope you enjoyed this episode of the Morale Monologue. If you did, please give me a thumbs up and subscribe to the SMA News Today YouTube channel as well. We would greatly appreciate it. Remember, when you do subscribe to the channel, make sure that you click on the bell icon. That way you'll be notified of any new videos that we produce. We at SMA News Today hope all of you have had a great day. Do me a favor this upcoming week. Make sure that you do something for yourself to make you a better person. Again, my name is Michael Morale. You've been watching the Morale Monologue, and I hope you enjoyed it. Have a great day, everyone, and I'll talk to you in a couple of weeks. Bye-bye.